Hello there, and welcome to our Friday happy hour. My name is Julie Hirschberg, the founder, owner of Reactive Therapy and Wellness in the Los Angeles area, joining you today to talk about some of our favorite things, which are functional movement disorders, and particularly how we can better understand them and talk about it and apply it to therapy. This week has been really all about what's happening in the latest literature. I love getting updates. I follow some of my favorite researchers on Twitter, and whenever they post something new, I'm going, oh my gosh, this is great. And I am reading it. I read a lot, love reading. And this week, there were two particular articles that struck me. One of them was about attention and the role of attention in driving a functional movement disorder. They did a really beautiful study. I talked about it in our video on Wednesday. So if you're on our newsletter, you'll get that video from Wednesday talking about the article on attention and the link to the article as well. By the way, we have two different newsletters. I don't know if you know this, but if you're a healthcare provider, we have a newsletter sending out all of our educational resources and courses and things like that. You can sign up for that on our education page, and that's reactivept.com/education. But if you are a patient, if you're a person experiencing a neurologic disorder, every Monday we send out a newsletter with these videos as well, and with resources that are really good for you. So that sign up is just on our main page at reactivept.com. So if you want to get the videos and resources, you can sign up for either of those newsletters, but the Friday newsletter is really geared towards healthcare providers, and the Monday newsletter is geared towards the person with the neurologic disorder. So I wanted to tell you that I send out these videos to both. So on Wednesday, we talked about attention. We're going to talk about it a little bit today because it came up in this other just fabulous story. I'm sorry, fabulous research study. I have been so excited to talk about this study. I just can't wait. So, let's talk about control. I just have to tell you a little story. When I was in, I think about fifth grade, Janet Jackson was like one of my idols. And I actually did a solo dance to her song Control. And I still remember the choreography to it. So whenever I talk about control, I think about like some of the dance moves from Janet Jackson's Control song. And I think that's kind of the soundtrack to our day when we talk about control and talk about regaining control in functional movement disorders, which is huge. So today we're going to talk about this really great study. It came out just last year. And let me give you the title of it. The first author is, last name is Fobian. This is a group from the University of Alabama, by the way, and it's called Retraining and Control Therapy for Pediatric Psychogenic Non-Epileptic Seizures. And August 2020 is when it came out. And by the way, the pediatric psychogenic non-epileptic seizure, or PNES, we're talking about functional seizures here. So what we'll talk about today is a little bit about the background. So what is this, why actually? We'll start with the why. Why this retraining and control therapy? We're talking about resuming control. So I love that they even called it. What this consisted of. Now, I wasn't in the research study. I'm not also a psychologist, so I can't tell you exactly what they did, but they provided some really great resources of what this was based on. So I'm going to highlight those. We're going to talk about the incredible results because they're incredible, and the implications for us as healthcare providers. So let's dive in. Let me give you just a little overview, kind of like the abstract view of the article. So they took, I think it was 29, let me see, 32 patients. They ended up with 29 at the very end. So it's a smaller study, it's a pilot study. They randomized them to two groups. These were kids with functional seizures. And one group got a typical supportive psychotherapy. The other group got this retraining and control therapy. They did 8 weeks of this. And essentially, what they found is that the kids in the retraining and control therapy had 100% recovery. 100% of the kids after the 7 weeks of treatment had zero seizures. They followed them up for 60 days, and 82% of those continued to remain seizure free. None of the kids in the, well, I shouldn't say that. One kid in the supportive therapy also was seizure free, but the rest of them had their same number of seizures throughout the course. In fact, they moved those kids into the other group so that they could get the treatment because so many kids were getting better. So that's the study in the nutshell. If that doesn't get you excited, I don't know what gets you excited. That gets me excited to see a result where 100% of the kids are seizure free, functional seizure free at the end. I think that's phenomenal. So why look at this? Why look at this retraining and control therapy? And so this group, which by the way studies and looks at this extensively, I have several articles by this group from University of Alabama. So when they look at the literature, when you look at things that may lead up or predispose somebody or perpetuate somebody having a functional seizure, one of the big pieces is the person's perceived control over their symptoms. That makes a lot of sense. That's like in all of the functional neurologic disorders, people don't have control. It's involuntary. They've also found in kids who have the functional seizures, they have expectations of a catastrophe based on the symptoms. And when I say catastrophe, I really like the example they use in the paper, which I really like if the kiddo's having pounding in their head and a headache, they're automatically going to I'm going to have a stroke and I'm going to die. So catastrophic thinking of a medical event or a health problem from a symptom. And what this group has found, by the way, I'm going to point you to another article that they also wrote that I found really enlightening for this, is that actually, as you can imagine, would worsen the symptoms and actually lead to having some of the symptoms because you have that expectation. So you have these thoughts and beliefs about the symptoms. You also have this total lack of control. When you have these thoughts and beliefs about symptoms, when you have a lack of control, one of the things that it will generally cause you to do, which makes sense, this is what the brain should do, it will have you attend heavily to those symptoms or any even like inkling of the symptom, right? So you are also going to have a heightened attention and awareness. And that's what I talked about on Wednesday, that that high attention can actually really disrupt movement because it takes us out of more of the automatic movement capabilities that we typically have. Okay, so with those pieces in mind, that understanding of the pathophysiology of functional seizures, both being attention related, belief related, learning related, and a lack of control, it would make sense that helping to restore those things, restoring control, restoring normal attention, reframing and relearning the beliefs about symptoms as well, that you could actually help somebody recover from this. Brilliant and very simple. So essentially, that's what they did. They supported the development of this treatment approach based on that understanding of the pathophysiology, which, by the way, is not just theoretical. They actually, if you look at the literature, and I've talked about this before as well, if you look at the literature in functional disorders, you actually see these areas of the brain being impacted. So the right temporal parietal junction, which is a self-agency area of the brain, is impacted in functional neurologic disorders. So it's not just like, oh, we hypothesize this. This is actually what shows up on imaging as well. So, various different psychological treatments and therapies have been used in functional disorders and in functional seizures. Cognitive behavioral therapy is one of them. And they highlight in some of the past studies, people get better with that, but it's usually about a quarter to half of the patients get better. Not what they found in this study, for sure. So it really does, show us that we could really use something better, right? So I'm always about like, what else could we do better here? So let's talk a little bit then. That's the background. Okay, so attention, control are big contributors to functional seizures and functional neurologic disorders. So what they did 8 weeks. They did a one-on-one session with parents and a one-on-one session with kids, and then they came together. They did goal setting, and basically what they did was work systematically to help the kids regain control and to shift their attentional focus and to reframe some of their beliefs and understanding about their symptoms. So I'm going to highlight another article here, and let me actually pull it up for you here. I'll put a link in our newsletter for this one, but it is called, I was just reading it. Anybody else read on their iPad? I love reading on my iPad. I love drawing pictures on it and highlighting. So this one's called A Review of Functional Neurologic Symptom Disorder Etiology and the Integrated Etiological Summary Model. So I highlight this because in this Re+active therapy paper, they highlight this as some of their real like model for how they put together this therapy. And so to me, they listed like what they did week to week, but I really wanted to understand like, what are you doing and what is this based on? Like, what's the understanding based on? Because I think for us as physical therapists, one of the biggest pieces of our success in functional neurologic disorders is understanding the whole person. And I believe that becomes a big piece of being a psychologically informed physical therapist or occupational therapist or speech therapist or neurologist, so that we can understand how some of these functional symptoms could actually be learned so that we can help somebody unlearn them. So what they do in this supporting article is actually walk through a model to show how there are internal and external predisposing factors like physiological pieces and trauma and physical injury that can contribute, and that physical symptoms are misinterpreted as a health problem. And this is a really complex thing. It has to do with cultural beliefs and expectations and past injuries. And if your kid, like, also, what is your parent thinking? What's their anxiety about it? If you're a health professional, actually being exposed to some of these things, being exposed to these things in the media, having exposure to illnesses and experiences. And this creates a scaffold of your health and your beliefs. And what they propose in the model is that there then is a misinterpretation of symptoms as the illness that leads back to an expectation of symptoms, and potentially anxiety, which can actually cause more symptoms. Now, this isn't saying that the seizures or the functional symptoms are caused by anxiety. It actually kind of puts together a very complex model of how the interaction of these physical things, physiological things, beliefs and expectations and anxiety all can contribute to the functional neurologic symptoms. And then how those can become learned and habitual and involuntary, not under our control. That, remember, in a functional neurologic disorder, this isn't somebody purposefully faking these things or trying to do things. They're totally involuntary. But what they point out and what they've done in this study is that they have helped, through 8 weeks of therapy, a person relearn and regain control and change their attentional focus. And and in the end, what we find is they're seizure free, which is just incredible. So this 8-week program they did is basically a relearning program. And I think that's really quite phenomenal. So again, if you want to dive into a little deeper of the understanding of what they might have done, I recommend this second paper. Again, I'll link to it in our newsletter. But it's a little bit of their background. By the way, something else that was really cool is this treatment was provided by psychology doctoral students. And that just makes me really thrilled. We have 2 amazing psychology doctoral students at our practice right now. And I just feel so lucky to be able to work with them, because I think there's a really great potential for this to be very accessible for people. Not that you have to work with somebody who has worked 40 years in functional neurologic disorders, right? But this could be, I think, and this is why we teach about functional neurologic disorders all the time, this can be learned, and this can be really helpful to help learned by psychologists, psychology students, physical therapy, physical therapists, physical therapy students, occupational therapists, occupational therapy students, and on and on and on. I don't want to say it's easy. It's not easy, but it's actually based on some simple ideas that can be implemented. So, so as I mentioned, I'm just going to highlight it again. What were the results from this? So again, 8 weeks, once a week of therapy, and they had a control group in just supportive therapy, kind of standard of care. 100% of the patients had 0 seizures in the 7 days after the end of the treatment. And actually, on average, it took them about 4.6 weeks or 4.6 visits, almost 5 visits to get there. So they actually got there pretty quick. At the beginning of the study, on average, most people were having about 3 seizures a day. So 3 a day to none, that's pretty incredible. And then they followed up with them at 60 days, and 82% of them remained seizure free. That's also really, really promising to me. Because again, this is pretty short amount. It's an 8-week bout, and it was just that Re+active therapy, which is funny because we're reactive. That's not the reason I love this study, but that just hit me. Like, as I read it there, I was like, oh my gosh, it's called Re+active, Retraining and Control therapy. I would argue, so what does this mean for us as healthcare providers? I'm not a psychologist. I'm not going to be doing this 8-week program with kiddos, right? But our psychologists will certainly, and I would even say they're already doing this. I think many people working with kids and adults with functional neurologic disorders, many of the psychologists are already working on these pieces to help people regain control and autonomy, and change the focus of attention, and provide strategies to relearn their responses and their beliefs about symptoms. I think that's happening a lot. This particular study did it in a very specific way. I think that's something for us to learn about. And even as a physical therapist or occupational therapist, here's where we become psychologically informed. What did they do here? They helped kids relearn. This is what we do all of the time with movement. This is what we do all of the time with habits. We help build different habits, different learning responses. We help uh, unleash some of those automatic movements through learning. These are principles of motor learning and control that we already know. So this is, for example, this is the optimal theory. This is providing autonomy and control within our therapy. This is how I think we can incorporate the Re+act program into really anything that we do. Another thing I would say is like start that conversation. As soon as I read this paper, I sent it to our psychologist. I was like, check this out. And our psychology students, check this out. Look at what's happening in this study. Like, what are they doing? What is this about? Like, what do you think? And start that conversation. Start it with the providers that you're interacting with. I'm so incredibly lucky to work with an interdisciplinary and integrated team so that we're talking about this all the time, not just with how can you implement it in psychology? How can I implement it as a physical therapist? How can I get to that 100% symptom-free recovery rate and truly help people stay that way too, right? So I think that's another piece. Let's, start the conversation. Let's work together. Let's work with our psychology colleagues to restore normal attention and control. We do that through motor learning and control. They do that through understanding a person's beliefs and reframing as well. So I'm really excited about a study like this. Now, remember, this is a small study. There were 29 people in it. They did have a control group, so that's powerful, but it's still pretty small. More needs to be done in this area. I'm not just going to go out and say, hey, everybody get to Alabama, you get in this like study, you need to do this. I don't think that's the answer either, but I think it gives us a window of what is possible and what we need to consider including. And I'm so thankful we have this in our integrated program that we do. We have a 4-week intensive integrated program for people with functional movement disorders. And we've had great results with it. And so I'm going, okay, like this is a lot of what we do. How could we even do this better? Right. This is also, as you know, I'm super passionate about functional movement disorders. Next weekend, we're doing a free webinar for healthcare professionals. We need to share the research and the evidence of what is working here and also what's not working so that we can all be better. We can all be better therapists and we can all be better at helping people with functional neurologic disorders. That is part of our absolute mission here with our education team, is to be able to help more people with functional disorders have access to healthcare providers that understand it. So we're doing a free, absolutely free webinar called Functional Movement Disorders Made Simple, where we walk through this and other literature and just make it very, very simple to assess and to help treat. So I hope you'll join me for that. It is next Saturday, September 18th at 9 a.m. If you're catching this video after that, it's recorded. You can grab it. So we'll be recording it. You can watch it anytime. And we just really want to help and empower healthcare providers to help people with functional movement disorders. So I want to thank you so much for just tuning in with us and to really furthering your own knowledge. I have learned so much by being a part of our community that learns together. So I want to thank you for that. And I hope you have a really wonderful weekend. Thanks.